Thank you all for being here for this very important panel discussion on the governance and financing of graduate medical education on the day of the release of a new IOM report on the subject. I'm George Tebow, president of the Josiah Macy Foundation, and pleased to be one of the sponsors of this report. Like all other people who did not participate in the process, I didn't see the report until just shortly before this meeting. So we're not here to debate the details of the report. There's going to be plenty of time of that. What I want to try to highlight at the beginning is why this report is so important, why it's timely at this point, and why the general direction and issues of the report are the ones that we believe we should be following. I'm going to introduce my panelists after making some introductory comments, and I'll let you know that we're going to try to end by 3:15 because of people's travel plans. So let me first talk about the importance of graduate medical education. That important period of time between medical school and independent practice, which is really what does determine the size, composition, distribution, and skills of the physician workforce in the country. There are now nearly 120,000 participants as residents or fellows in that graduate medical education process. It has evolved over the past century from an apprenticeship to a very large and complex formal operation with many, many stakeholders. And though graduate medical education in this country has often been seen as a model for graduate medical education around the world, and justifiably so, in every decade since the 40s, there have been commissions, studies, and reports, both from governmental and non-governmental groups, calling for reform of either governance or financing or content or conduct of graduate medical education. Most recently, the Josiah Macy Foundation, which had also sponsored calls for reform in the 80s and 90s, in 2001 sponsored 2 conferences on graduate medical education entitled Ensuring an Effective Physician Workforce. One of those conferences dealt with the issues of governance and finance, and the other dealt with the content and conduct of graduate medical education. Why did we choose to look at graduate medical education yet again? There were particularly compelling reasons why this is an important and propitious time to re-examine our graduate medical education enterprise. The changing demographics and disease burden of our patient population and the changes in the healthcare system, which actually began before the ACA but were accelerated by it, both of these changes call for new skills and new experiences for our future doctors. At the same time, we also have new and changing technologies for healthcare delivery, for information, and for education. And we have a rising and appropriate increasing concern about healthcare costs, about the cost of education, and the state of the federal budget. At the same time, there has been growing concern about the adequacy of the physician workforce, at least insofar as its geographic distribution and specialty distribution, if we are to meet the needs of the public that we serve. We entered this with the realization that much has changed since the series of legislations beginning in 1965 that involved the federal government in paying for graduate medical education, and further with the realization that we will not likely have enduring healthcare reform in this country unless we pay attention to the nature, skills, size, and distribution of the physician workforce, and as I would say as an addendum, the whole healthcare workforce, which we are very interested in, but which is not the purview of this study. So this IOM study released today was the direct result of those 2 conferences which we held, and I'm proud that we were the principal sponsor along with 11 other private foundations in 2 government agencies. The report is very thoughtful, very well reasoned, very well documented, and addresses many of the issues that have been raised by our previous reports and by other reports from the past. Let me just list some of the common themes that I think are important for us to focus on. First of all, the report affirms the importance of graduate medical education serving the public needs and justifies, therefore, continuing funding for Medicare for it. This is a very important point, to assure stability, but also to give the opportunity for creating change. It calls for greater accountability and for public reporting. It calls for incentives for innovation in graduate medical education to meet contemporary needs. It calls for incentives to diversify the sites and content of graduate medical education. And it further calls for research to study the effect of these changes in ways to improve graduate medical education. Finally, it creates a mechanism to fund new graduate medical education positions if warranted. And it calls for a gradual phase-in so as not to disrupt the very important and valuable academic health centers which serve many very important missions in our society. To accomplish these goals, though, it does call for some fundamental restructuring of both the payment and the oversight mechanisms for the Medicare funding of GME. Now, I will point out to you, and it won't come as a surprise to any of you, that these are very complex issues. They will not be settled overnight. And we need to engage in a constructive, ongoing discussion of the best ways to modernize and improve the system to serve the needs of the public. It's our hope that this is the beginning of that constructive debate among all stakeholders, public and private, across the profession, to achieve this modernization and to achieve this better way to serve the needs of the public. I will quote from the report, "This is the time for all those engaged in the GME system to work together to produce the physician workforce that the nation needs." So I want to thank the IOM, thank the committee that produced this, and then particularly thank Gail Walensky and Don Berwick, who chaired it, for a very, very impressive bit of work in an exceedingly complex area that many have approached before, and I think they've approached it more successfully than any that I've seen in the past. Now let me introduce the panelists. We're going to have comments from, on my left, your right, and it actually wasn't particularly arranged this way, so it turned out, are comments from the committee that produced the report. Gail Walensky has served as co-chair, and she is an economist and a senior fellow at Project Hope and a former head of CMS. Deborah Weinstein is the vice president for graduate medical education at Partners Healthcare in Boston and an associate professor of medicine at Harvard Medical School. And Deborah Powell is a dean emeritus and professor of pathology and laboratory medicine at the University of Minnesota. On my right are two observers who had the same short time period in reading the report that I had, and we will have more time to reflect and discuss. But they bring two valuable perspectives. Malcolm Cox is currently an adjunct professor at the Perelman School of Medicine at the University of Pennsylvania, and he was formerly the chief of academic affiliations for the Department of Veterans Affairs, another important sponsor of this study. And on his right is Ed Salzberg, who's a research faculty of the George Washington University School of Public Health and Health Services and the School of Nursing, who formerly was the director of the National Center for Workforce Analysis as part of HRSA and as a nationally recognized expert in workforce issues. So we'll start with comments from the committee, and then we'll turn to comments from the observers, and then we'll have time for questions from the audience. Gail.